Assalamu alaikum. The current lectures will talk about the infectious diseases, pathology. In these lectures, the aim of these lectures and the objects of these lectures include know several types of infectious agent, what are the types of infectious agent, the pathogenesis of the infectious process, and how these infectious agents spread throughout the human body, and what histopathological changes these infectious agents that may cause inside the human body. First of all, we must define infection. Infection is defined as invasion of the living tissue of the human body by microorganisms. These microorganisms, either they are pathogenic from outside the body or sometimes commensal microorganisms that are microorganisms living on the human body but without causing any disease unless in certain conditions. Or sometimes it's not by the microorganism itself but by its products, that is toxins produced by these microorganisms, which produce usually either local reaction or sometimes abscesses, or sometimes this is associated with general reaction, as in case of fever, myalgia, nausea associated with infectious process. Regarding the commensal microorganisms, these are called microbiome and representing millions of microorganisms that present on the surface of the body, inside the GIT, nasal cavities, and usually they do not cause infection, but under certain conditions, when there is immunosuppression, they cause infections, and these infections are called opportunistic infections. The outcome of infection, the result of infection, usually depends on the balance between factors related to the microorganisms and factors related to the host. That is microorganism, how it is aggressive, how it does cause disease, and regarding the host, that is how the host defends itself, the ability of the immune system to defend the microorganisms. We must know certain terminology and certain terms regarding the infectious process. For example, an infectious disease is defined as the transmissible or communicable disease that is transmitted from person to person, either directly from person to person or sometimes indirectly by the presence of mediators such as air, water, contaminated food with the microorganisms such as bacteria or living vector. Sometimes the term infection, when we say infection, doesn't always mean that there is disease on the human body, because sometimes the human body is infected but there is no features or no symptoms that are present. That is, the infection is dormant without causing any symptoms to the human. When we say infectivity, it means that the ability of the microorganism to gain entry and to proliferate to the host. That is, the more the infectivity, the more likely the microorganism get in the host and spread in between the human beings. When regarding contagious disease means disease that is easily transmissible, transmitted by contact from person to person, and this should be differentiated from other ways of transmission of infectious agent, such as in case of sexually transmitted diseases or vectors. In contagious diseases, quarantine is required, whereas in sexually transmitted diseases or infectious disease that requires vectors, usually medical isolation and the quarantine is not required. The term virulence means the likelihood of the microorganism in causing severe disease. That is the degree of pathogenicity in other terms. So when the virulence of the microorganism is more, it is more likely that microorganism cause disease and severe disease. Other term, including the primary pathogen and secondary opportunistic pathogens. Primary pathogens means the microorganism by itself cause disease to the normal human being by its inherent virulence of the microorganism itself. Whereas in opportunistic pathogens means that the microorganisms do not cause infection or disease to the normal human being, but when there is immune suppression, the such microorganism can flourish and cause disease. Example of this is that the candida, which is normal flora present in the human body, when there is immunosuppression, the candida flourish and cause candidiasis. Other term is that zoonotic disease. We mean by zoonotic disease that are infectious diseases that is transmitted from animals to the human being, either by direct contact or sometimes by drinking their products, such as in milk, contaminated milk, or sometimes by a vector as in malaria. Based on the type of causative agent, infectious agent can be classified into several types. We have either living infectious agent or non-living infectious agents, and either are composed of a single cell or microorganisms that are composed of more than one cell. So first of all, the infectious agent is prions. Prions are presenting a protein. They are non-living microorganisms. They are protein, abnormally structured the protein. They present in cattle, in cows, and they are the cause of جنون البقر. And when they eaten by the human body, when the contaminated the diseased cow is meat is eaten, or brain is eaten by the human body, it causes infection to the human body by such a protein, abnormal protein that is present in the cattle, enter to the human body and cause abnormal conformational structural change in the human body protein and cause the infection. The other including bacteria, single cells, viruses, fungi, and parasites. Regarding factors that influence the infection, we have mainly three interacting factors. We have factors related to the microorganism and factors related to the host, that is defense factors, and other factors. First of all, we have microorganism factors. First is that the dose of the microorganisms. Usually the higher the dose, the number of the microorganism, the more likely the microorganism to cause disease. There are certain number of microorganisms to cause disease, or minimum number of microorganisms that cause the disease. If less than this number, there will be no disease. The person exposed to a small number of microorganisms, then there will be no disease. The second one is that virulence, that is the ability of the microorganism itself to cause the disease. The more virulent the microorganism, the more likely it causes disease. And third is that invasiveness, they defined by ability of the microorganism to multiply and separate inside the human body. And fourth is that transmission, that is, it means that the ability of the microorganism to transmit to another suitable host, that is, microorganism enter through the inhalation, ingestion, sexual intercourse, inoculation, and bite or injection. Whereas host-related factors, that is, defense factors related to the human body, is divided as into either non-specific defense mechanisms or specific defense mechanisms. Non-specific defense mechanisms are presenting the innate immunity of the human body, and this is presented by either mechanical barriers, such as in case of the skin, which is covered by stratified squamous epithelium, keratinization, and this keratin layer prevent microorganisms from entering to the inside of the body. The second one is that the glandular secretions of the human body, as in case of acidity of the gastric juice, the gastric juices which kill the microorganism, acidity of the sweat, the presence on the surface of the skin, and the presence of immunoglobulins, secretory immunoglobulin IgA, that are present in many secretions of the human body, including saliva, tears, intestinal secretions, and milk. The other one is that the secretion currents, that is the flow of the fluid present inside the human body, which clear the microorganisms. This is presented by flow of urine through the urethra, which clear the urethral tract from microorganisms, prevented from ascending from the urethra to the urinary bladder. Also the saliva and diarrhea and ciliary movement. The fourth one, which is not specific, is phagocytosis, here exemplified by the macrophages and neutrophils, which are the first defense mechanisms against many infectious agents. So when an infectious agent enters the body, especially bacteria, the macrophages and neutrophils are activated and they engulf these microorganisms. The Other type is that it's specific defense mechanism. When we say specific defense mechanism, we means the immune response, which is usually specific against certain microorganisms. That is, defense is directed against specific microorganisms. This is mediated either by cell-mediated immunity, T-cell immunity, helper or cytotoxic, and the humoral immunity represented by the production of specific immunoglobulins by the plasma cells against each specific type of microorganism. Regarding other factors, we have local factors, such as in case of ischemia, any dead tissue or ischemic tissue representing a good culture media for certain type of microorganism called saprophytic microorganisms, and so they proliferate. The other one is that presence of foreign body. This is in case of contaminated wounds, in case of blast injuries, shells that are present inside the human body, and these represent foreign bodies or shells representing good culture medium for recurrent infections to the human body. The other factors that systemic factors in case of malnutrition, diabetes, chronic alcoholism, and malignancy. All of these systemic diseases affect the defense of the human body, affect the defense of the immune system, and resulting in the decrease in the immunity, and so there will be predisposition for infections. The other one is at age. We know that the very young people, infants, and elderly people are more likely to develop infectious agents than young people. And lastly, that is drug. Use of certain drugs affect the course of infectious agents, such as in case of antibiotic use. This confer protection against the infectious agent, and on the contrary, certain drugs used as in case of malignancy, immunosuppressive therapy, predispose the human to infections by microorganism. Regarding the routes of entry and dissemination of the microbes or microorganism inside the human body. At first, the microorganism or infectious agent must get entry to the inside of the human body, and this is usually done by either a break in the defense mechanisms, or sometimes by the microorganism have the ability to penetrate the surface skin or the mucosa of the human body. So the entry is either through the skin, respiratory tract, gastrointestinal tract, or genitourinary tract, either through the skin or the mucosa. The microorganism, after entering through the mucosa, and then it spreads through several ways, either through the nerves or lymphatics or the blood. This depends on the type of the microorganisms. Certain microorganisms have tropism for certain organs, such as in case of varicella, rabies virus. These viruses, they have the tropism for a neural spread. They enter through the blood, mucosa, and spread over skin, and spread through the nerve fibers to the central nervous system, and thus such causing disease. Whereas other microorganisms, they spread through the blood or the lymphatics. They enter into the blood, and they get to the inside of the cells using certain of the cells, some of the cells, such as macrophages and Mycobacterium tuberculosis. The microorganisms get inside the macrophages and use it as a way of transmission to the human body, which it transmits through the lymphatics or even the blood and spread to other organs of the body. Certain microorganisms have, as we said before, have certain tropism for certain organs. An example of this is that hepatitis viruses, which get into the inside of the blood, they transmit through the blood and settle in the liver, causing disease of the liver, that is hepatitis. Other microorganism is that the mouse virus get to the inside of the human body. They go to the salivary glands and establish disease in the salivary glands, cellulitis. And other microorganisms may have non-specific tropism. They cause disease either in the kidney or in the skin or lung, as in case of Staph aureus. And as we said before, other microorganisms have tropism for central nervous system, as in case of poliomyelitis. The results, that is the outcome of infection. We have 4 results, outcomes for infection. The first one is that there is eradication of the infection and the person return to normal state, which is the good result. And the second one is that there is persistence of infection. Persistence of infection, that is, the microorganism is still present inside the human body, and this is either in the form of the carrier state, that the person is asymptomatic but can spread this infectious microorganism to other people, or sometimes the microorganism are producing mild chronic form of the disease that lasts for several years before causing a severe or acute exacerbation of the disease. The third one is that microorganisms spread from each site to another site. This is either directly, that is in case of wound infection, spread directly to the other parts of the limb and causing cellulitis, or sometimes the microorganism spreads through lymphatics, causing lymphadenopathy, lymphangitis, inflammation of the lymphatic channels, and inflammation of the lymph nodes, that's lymphadenitis. Or sometimes the microorganism spreads through blood to the other sites, as in case of tuberculosis, that may spread from the lung to other organs such as kidney or liver or other sites. The last one is that the last end or result of infection is that death of the organ, and this occurs in certain infections, serious infections, or cases of septicemia, and this example is a case of tetanus. The tissue response to infectious agent, that is microscopic changes caused by infectious agents inside the body. And this may, the microscopic change or finding of certain microscopic changes inside the slide or inside the tissue, this gives you an impression about the type of microorganism that have caused the disease. We have 5 major histopathological patterns. The first one is that suppurative inflammation. It means by suppurative inflammation there will be pus formation, there will be abscess formation, which is defined as collection of microorganisms, necrotic debris, inflammatory cells surrounded by pyogenic membrane, and this is usually caused by bacteria, certain type of pyogenic bacteria. The best example of this is Staph aureus. The other one is that there will be a chronic inflammation and scarring. This occurs in certain infections that cause chronic disease, and as we know, the chronic disease is associated with healing by fibrosis at the same way, and this occurs in many viruses, best exemplified as viruses. An example of this is that hepatitis B virus, when infect the human body, causing a chronic hepatitis virus. In a chronic disease, there will be chronic injury to the hepatocytes. This is followed by a chronic disease formation of fibrous bands and regenerative nodules producing liver cirrhosis. Also, in case of schistosomiasis, parasitic infestation, there will be deposition of eggs, and there will be reaction of the human body against these eggs by chronic inflammation. This is followed by fibrosis around them and scarring. And also in case of tuberculosis, there will be granulomatous inflammation followed by fibrosis and scarring of the affected organs or lung. The third one is that when there is mononuclear and granulomatous inflammation, this is found in tuberculosis and syphilis. In syphilis, we find mononuclear cell infiltrate, that is much lymphocytes and plasma cell infiltration, especially around the blood vessels, and in granulomatous inflammation, best seen in tuberculosis. The fourth one is that cytopathic and cytoproliferative inflammation. This is seen in viruses. Cytopathic effect, that is, we see that certain viruses cause the cells to proliferate and cause changes inside the cell. So some viruses are producing multinucleated giant cells, and they may produce inclusion body, so inside the nucleus or in the cytoplasm. Whereas cytoproliferative inflammation, this is best exemplified in wart or human papillomavirus. When affect the skin, stimulate the stratified epithelium to proliferate and produce wart. The last one is that necrotizing inflammation. Certain infection when affect certain microorganism when affect the human body cause damage to the human body and necrosis. This is produced either by microorganism itself or by the production of toxic material, and this is seen in Clostridia perfringens, which produces gangrene to the tissue, or sometimes parasites, as in the case of Entamoeba histolytica. When affect the gastrointestinal tract, they affect the GI, the mucosa, causing lysis of mucosa and causing multiple ulcerations. Bacterial infections. First of all, classification of bacteria. Bacteria is classified into several types, many types, according to certain features. First of all, according to the gram stain, bacteria can be classified into either gram-negative, that is appear red in color, or gram-positive, they appear dark blue in color. According to the shape, bacteria has been classified into cocci, they are representing round structures, or bacilli, that are rose, vibrios, comma-shaped microorganisms, or spirochetes, they are twisted microorganisms. Or sometimes according to the growth requirements, which is classifying bacteria into aerobic, that is requiring oxygen for its proliferation, or anaerobic, that is doesn't require the oxygen for its proliferation. How does bacteria cause disease? That is pathogenesis, or mechanism of bacterial injury. Bacteria enter into the inside of the human body. They cause disease by several mechanisms. Mainly there are four mechanisms. They either they produce toxin that kill the cells, and this toxin is either produced by the bacteria itself, which is called exotoxin, or sometimes the toxin presents a component of its wall or structures that is called endotoxin. The second way is that bacteria release enzymes. These enzymes cause lysis of the target cells, target human cells, and then cause disease. These enzymes may include proteases, cause lysis of protein, hyaluronidase, coagulase, or fibrinolysins. So, in lysis of the target cells, lysis of the extracellular matrix of the human body, this causes disease by itself, and also make it easy for the microorganism to spread inside the tissues of the human body. The third one, the bacteria cause disease by inducing an inflammatory reaction against them, and such an inflammatory reaction, if severe, they can cause disease to the infectious disease, to the tissue and to the infectious agent. The fourth one is that bacteria can cause disease by inducing the excessive immune reaction. And this is basic example of this is that when there is infection of the upper respiratory tract by certain microorganism, as in case of streptococci, there will be development of immune reaction against these streptococci and development of antibodies against them. But these antibodies may react against the valves of the heart or even the glomeruli, so producing rheumatic heart disease and post-streptococcal glomerulonephritis, that is called cross-reactivity. Bacterial infections is divided usually into acute infections or a chronic infection. That's in acute inflammation and chronic inflammation. Acute bacterial infection, we have example of this is that catarrhal inflammation or catarrhal infection. Here, when there is infection of the organ that produce much mucus material, that is infection of the mucous membrane, this is called catarrhal infections. Or sometimes the serous changes. Serous, this is accumulation of much serous clear fluid presence inside the body cavities, whether in the pleural fluid accumulation, pleural effusion, or inside the peritoneum, producing ascites. Such acute infections also may produce pseudomembrane. Here, from its name, there will be formation of a pseudomembrane, not a true membrane. This is formed by ulceration of the covering of the affected mucosa by microorganism, and then followed by inflammatory reaction, accumulation of necrotic debris and bacteria, forming a membrane-like structure attached to the mucosa, which is called pseudomembrane, and this is seen in pseudomembranous colitis. Or sometimes bacteria may produce pyrogenic or suppurative infection, that is will be abscess formation, and here the microorganism induce inflammation and secretion of interleukins and tumor necrosis factor that will stimulate also the complement system and attract the inflammatory cells to the site of injury. Such inflammatory cells, for example, neutrophils, they contain enzymes. These release their enzymes to kill the bacteria, and also at the same time they affect the surrounding tissue, so producing abscess formation. This micrographs representing an abscess formation here in the neck means we see localized swelling associated with redness, representing abscess formation in the neck. This is an example of the colon. Here, pseudomembranous colitis. We see this ulceration of the overlying mucosa, with the mucosa of the colon, associated with the glistering exudate and congestion of the mucosa, with formation of such yellow greenish pseudomembrane attached to the surface of the mucosa. The bacterial infections inside the blood, we have four terms. We have bacteremia, septicemia, pyemia, and toxemia. First of all, regarding bacteremia is defined as presence of a small number of microorganisms, that's bacteria inside the blood without multiplication, without proliferation. That is a small number and without multiplication. Usually this produces no symptoms or sometimes very mild symptoms. And best example is that when there is brushing of the teeth, aggressive brushing of the teeth, the microorganism, commensal microorganism present inside the mouth, Streptococcus viridans, get entry to the inside of the blood and producing bacteremia. Bacteremia usually resolved by neutralizing antibodies that's present inside the blood, but in certain conditions, certain persons with abnormalities in the cardiac valves, they may be exposed to infections as infectious infective endocarditis. Whereas septicemia is defined as the presence of pathogenic, highly pathogenic, virulent microorganisms inside the blood associated with multiplication. So the presence of microorganisms, highly pathogenic, virulent microorganisms inside the blood with multiplication, this produces a profound toxemia and severe symptoms to the host. And this is serious. It has serious consequences and serious results that might cause death to the human body. Usually, the patient have symptoms of tachycardia, hypertension, and multiple small hemorrhages due to endothelial damage. That is features of septic shock. Regarding pyemia, pyemia from its name means pyemia from its name that means pus inside the blood. Here it occurs when the bacteria invade and multiply inside the blood and get to the inside of a thrombus. And when they get to the inside of the thrombus, they stimulate the inflammation, so there will be inflammatory cells of filtration of the neutrophils, and they produce their enzymes. So there will be formation of a pus inside the thrombus. And when such a thrombus dislodge and transmit inside the body, that's formation of emboli. This will produce septic embolus that is carried out through with the blood flow to other parts of the organs of the body, and they when settle inside the body, they produce abscesses inside these organs. Regarding toxemia, from its name means the presence of toxin produced by the bacteria inside the blood. Best example in case of diphtheria. This micrograph representing abscess formation. Here in the center there will be pus formations formed of mixture of dead microorganisms, dead neutrophils and inflammatory cells collection. This is surrounded by active layer of a granulation tissue and then an outer layer of dense fibrous tissue that localizes the pus material. Gangrene. Gangrene is defined as necrosis of the tissue with superadded bacterial putrefaction. That is, presence of dead tissue inside the human body, dead organ, and associated with superadded saprophytic bacterial infection. We mean by saprophytic bacteria, bacteria that proliferate, use the dead tissue for their proliferation and multiplication. The types of gangrene, there are three main types of gangrene: the gas gangrene, dry gangrene, and then wet gangrene. The gas gangrene at first, from its name, that is gangrene associated with formation of gases inside the tissue, giving the sensation of crepitus when touched, is usually caused by microorganisms of the Clostridia species, which are anaerobic microorganisms gram-positive spore-following bacteria. These microorganisms, they're present inside the soil, present inside the nature, and they get entry to the inside of the human body through the contaminated wound by soil. These microorganisms get inside of the body, they produce exotoxin, severe toxic substance, toxin, that causes damage to the human cells, will then invade the tissue and digest the dead tissue. There are many species of them. The best example is the Clostridia welchi, Clostridia perfringens, and the Clostridia septicum. These microorganisms producing cellulitis and gas gangrene, which is life-threatening disease. In Clostridia septicum, they are present inside the intestinal. They present in one of the intestinal commensal microorganisms in human and animals. They are anaerobic, so they do not proliferate when there is oxygen, but when the environment provides anaerobic absence of oxygen for them, they flourish and proliferate as a case of dead tissue and cause gas gangrene. How gas gangrene produce the disease? Pathogenesis. Clostridia species usually produce several types of toxins. These are called exotoxins. For example, is that alpha toxin that is listed in is. Here the alpha toxin affect the cells itself, cell wall, so cause lysis of the cell itself and causing cell death. The alpha causing lysis of the cell, and the cell is already dead. The other enzymes, including collagenase and hyaluronidase, here enzymes, they attack the extracellular matrix, representing the collagen surrounding the cells and the extracellular matrix surrounding the cells, causing them to lyse. The gas gangrene produce black discoloration and bad odor of the affected sites, some kind of skin or subcutaneous tissue. And the Clostridia welchi usually ferments the sugar. When it ferments the sugar, they produce gases such as hydrogen and carbon dioxide. These cell gases, they usually collect inside the tissues affected by the Clostridia as bubbles, giving the sensation of crepitus, and so the disease is called gas gangrene. This is an example of gas gangrene affecting the uterus. This is the uterine cavity, endometrial cavity, and this is the wall of the uterus. We see that multiple bubble-like spaces representing inside the myometrium, and these representing gases, spaces containing gases of gas gangrene. The second one is that dry gangrene. Dry gangrene, from its name, it means the organ of the affected part of the body is dry and black in color. It usually affects the distal part of the limbs as toes or fingers, and usually in cases of advanced atherosclerosis. Here, the gangrene usually spreads slowly till it reaches the line of good blood supply where it stops, and grossly it appears as a dry tissue, shrunken tissue, dark black in color. The dark black in color is usually attributed to the lysis of RBC and release of hemoglobin, and this hemoglobin will attach with hydrogen sulfide, producing the black iron sulfide, which give the organ the black color. Histologically, from its name gangrene, as you take in the cell injury, we see necrosis. The border between the living tissue and the gangrene usually shows a granulation tissue. Regarding wet gangrene, from its name, here the affected organs usually affect the organs that have more blood supply, more fluid content and water, that is moist tissues, as in case of mouth, bowel, lung, cervix and vulva. Here usually there is a block in the venous system, that is obstruction in the venous system or veins, and less commonly associated with arterial blood flow block. The organ, when there is a block in the venous system, the organ is usually stuffed with much blood. This much blood favors and congested. This favors the proliferation of bacteria, saprophytic bacteria, and release their toxic products. These toxic products usually absorbed by the nearby tissue and produce features of septicemia. They also may spread to the peritoneal cavity, as in case of wet gangrene of the intestine, and spread to the peritoneal cavity, causing peritonitis. Here, grossly, when I see grossly the organ, usually the organ is soft, swollen, and dark in color. Best example of this is strangulated hernia, volvulus, and intussusception. Here, in the intestine, there will be twisting of the intestine, and such twisting of the intestine will affect will close the veins of the system, resulting in venous system and causing congestion of the organ, followed by necrosis and then development of gangrene. Also, microscopically, we see coagulative necrosis associated with ulceration of the intestinal mucosa, in addition to inflammatory cells infiltrate. This graphs representing the difference between wet gangrene and dry gangrene. Dry gangrene, see black discoloration affecting the distal limbs, that is fingers or toes. There is sharp line of demarcation between the affected organ and the non-affected viable tissue, and the affected tissue usually shrunken, dry when touched. Whereas the wet gangrene, the organ or the part affected is usually swollen and wet, and the line of demarcation between the viable and the affected tissue is usually vague. This table representing the main differences between the dry gangrene and wet gangrene. Regarding site, the dry gangrene usually occurs in the limbs, whereas wet gangrene is usually seen in the bowel. The dry gangrene, usually we see arterial occlusion, whereas wet gangrene, venous is more. Macroscopically, the dry gangrene, from its name, the organ is dry, shrunken, and black, whereas the wet gangrene is moist, soft, swollen, and dark. Here, regarding the putrefaction, is usually limited, whereas there is macro putrefaction in the wet gangrene. Line of demarcation in dry gangrene is usually sharp, whereas in wet gangrene is usually vague. The bacterial perforation in dry gangrene is little, whereas in wet gangrene there is numerous bacterial perforation, active bacterial perforation. And regarding the prognosis, in a dry gangrene it affects the affected organ, whereas in wet gangrene it threatens life. And thanks.